It's a difficult subject, but it affects so many people. Cancer. And in this new age of technology, there's a greater hope for recovery than ever before. And here with more information about these new treatments is Dr. Arie from 21st Century Oncology. Good morning.
Good morning. Thanks for having me.
Really good to have you here, Doctor. I am excited to talk about the new technology that we have here in Southwest Florida. But what, first of all, is the role of radiation in treating breast cancer?
Sure. So radiation is one of the backbones of breast cancer treatment. Really, there's three types of treatments that you're thinking about when somebody has breast cancer. Surgery,
right,
which almost all women will have for breast cancer. Radiation, which nearly all women will have when they have breast cancer, and then chemotherapy. So radiation is really one of the standard approaches to cure a breast cancer. And usually you do radiation after surgery, either after a mastectomy where you take the whole breast off, or after a partial mastectomy where you take part of the breast off.
And it's a very precise, we're talking about that precise procedure targeting these cells, but one thing that was happening with a lot of women was that if they had breast cancer on the left side, the treatment was affecting the heart in a negative way.
Right.
But now you guys have something new that is able to help that. So let's talk about it.
Sure. So exactly like you said, when we're treating any type of cancer, we're focused on treating the area we want to focus on, treating the area that's at risk for the cancer, and minimizing any radiation dose to anything around it. For left-sided breast cancers, that can be somewhat tricky because right behind the breast and the chest wall is the heart on the left side. And for many, many years now, we've been somewhat aware that if we expose the heart to too much radiation, we can have long-term side effects, 5, 10, 15, 20 years later, where you can affect the valves, you can affect the arteries. And so we have always been wanting to try to avoid the heart in any way possible.
Sure. So now you have this DIBH. It's Deep Inspiration Breath Hold. And it's basically a way of monitoring your breath to compress your heart, push your heart down so that when you're doing the radiation, it doesn't affect the heart, correct?
Right. Just like you said, when you take a deep breath, your heart actually moves down and away from your breast. And so as simple as it sounds, you take a deep breath and you deliver the radiation when a woman is holding her breath.
Where can we find more information for just all of these things if ladies want to get more details?
Yeah, on our website is probably the easiest place,
okay.
www.2121co.com. And we actually have a link to Align RT on there, which is the name of this device.
Perfect. Well, thank you so much, Doctor. I appreciate you coming in this morning. You can find out more information on this segment by logging onto our website, fox4morningblend.com.